comes up a lot too. Thanks, Em. The question comes up a lot, and it would be great to even think about doing something in an office hours where we could kind of learn from one another because some folks have been successful in submitting cited and getting awarded, and for multiple rounds, and others haven't. So even if it's one where we excuse ourselves and give you guys time to kind of talk freely, it would be something to think about or explore.
Cool. And I'm gonna tag Leslie Gleason next.
Hey, good morning, everybody. Happy Friday. Goodness, what am I excited about 2024? Well, lots of things, but I guess the most on our mind is we have a new staff person joining us in a few days to take over the lead of our young adult program, our TAY program. So we are excited to be back and fully at capacity to meet the needs of that really important group. That I know is hot on everybody's mind. So I'm excited about what we're going to be able to accomplish with and for our young adults this year.
That's great news, Leslie. We'll definitely pick on you in Q1, and maybe you can talk more about that with the rest of the group. It's such an important, not that they're all not important population of focus, but I'm really curious what the first quarter of 2021 or 2024 is going to look like, with both the children and youth now being active for a few months, but the birth equity piece coming in, and so I'm excited for what the year is going to look like. But great news, Leslie. Thanks for sharing. For folks who want to come off of mute or a small enough group, please feel free to share. If you don't want to be sharing and or don't want to come off of mute, please share in the chat if you like. What are you most excited about for 2024? Ryan, how about you? What are you excited about for 2024?
I felt like that was probably coming my way, and I don't even think I have an answer necessarily. No, I mean, I don't know. I always like the beginning of a new year, so it's not I don't necessarily have anything specifically excited about, but I think in general it's always just it's a good time to sort of reset and kind of figure out. I don't know, it's full of prospects and hope, right? You start the year off strong, so
a refresh, right? Like
there you go. I'm just gonna go with that.
I absolutely agree. We'll keep things moving forward, if you want to advance to the next slide. But as folks are coming in and joining, please feel free to enter that information in the chat. Also with roll call, we can see who everyone is, but if you can enter your name and your organization's name in the chat, it always helps with roll call. If you are so inclined, we love to see everybody's faces. Not required, but absolutely encouraged. And Emily has some other helpful logistics here on the slide. We record these things for a number of reasons, mostly to make taking minutes easier. But if ever there is a reason or a concern about these sessions being recorded, just let us know offline, and we can reevaluate that in the future. Okay, go ahead, Emily, to the next slide. I feel like Emily, you're Vanna today, so I'll have to, yeah. Good show. Okay, so what are we talking about today? Well, welcome 2024. We're gonna do a quick temperature check to see how folks are feeling about the managed care plan transitions. And we're going to talk a bit about some of the different things that are happening around us. So we'll go through some both community, regional, and state updates and announcements. And then we will land on a test of change update and exercise activities. So that's what we have on the docket for today. We also too will encourage you, if you have a topic that is a hot topic that you want to cover, can you please just let us know in the chat? We can do a couple of different things. We can always take it offline. But in addition to that, we can make sure that we cover it or have that on the docket for office hours, which are coming up very shortly. Okay. Do you want to go through a quick overview of this next slide, and then maybe we can see if anybody has any questions or had any issues with registering for those in-persons?
As soon as I finish chewing the cheese balls that are in my mouth. Sorry, Denise and Ryan and I are all on the East Coast, and right now it's noon, so it's lunchtime. Anyways, so as you all probably know, since you are here now today, we have transferred from Google Meeting invites to Zoom registration invites. So in order to continue to meet with us and see our lovely faces every month, please go ahead and register. Once you click the registration link, which I will also include in the chat in a hot second, you'll be able to, you'll get an email and you'll be able to add these meetings to your calendars. And then for the in-persons, those are separate. So they're in-person meetings. We're doing one a quarter. And those are Google Forms that you'll have to fill out to register. And that's just so we know who to expect, how many bodies will be in the room, and how many snacky snacks to bring for people. So any questions, comments, concerns for me?
Great. Thank you
No?
so much for that, Emily. If you all are hearing from other community partners that they are having issues with registration, you can always point them our way via email. We're also going to post this new information on our website. So if anybody's having issues with registration or dates, we'll have that posted on the website as well. And then last but not least, office hours, which are new this year, are joint with the San Diego CPI. So they are meant to be sort of informal, come with questions, burning issues. And that is next scheduled in the second week of February. Last but not least, Calium Academy. So this is something that we did last year, but not in a very robust way. We're looking to expand on that this year. So if there are certain topics that you wish there were more informational webinars on, please let us know in the chat, and we'll make sure that we add that to the curriculum. Okay. Next on the docket is sort of a pulse check on managed care plan transitioning. So just a quick, how is it going? Are folks having issues? Are things working out really well? Anything with clients, patients served, contracting, reimbursement? Any questions? We just wanted to kind of open the floor up and see how this transition is working for you all, or not working for that matter. I don't mind a little bit of dead air, so I'll give folks a second to chime in, or you can send us a note in the chat. It could be that everything is going swimmingly and that this has been the easiest transition ever. Okay, all right. Well, let us know offline if needed, if there's any issues with managed care plan transitioning. So just as a refresh, we had Anthem leaving the market, and Kaiser coming in, and CCHP, I know, has been working on expanding some contracts in the late fall, early winter of last year. Okay, all right, we'll keep things moving along. And we will get into some other general announcements. So there we go. Thank you so much, Emily. I'm not going to read everything on the page. This deck will be shared with you all as well as additional materials. I know I've seen Emily adding some of that in the Slack as well. Just really quick, to Leslie's point, children and youth is an obvious, critical, important population of focus. There's a couple of things that are new for January of 2024. As I mentioned earlier, birth equity, and then in particular, as it relates to justice involved, both ECM for adult population and children and youth transitioning from correctional facilities as well. So there's some information and hyperlinks on this slide. We'll also provide them to you. If you're interested, DHCS is hosting a webinar on the 2nd of February for that birth equity. And so that will be upcoming if folks are interested in listening in on that DHCS webinar. Any questions on JI, justice involved, or birth equity before we move forward?
Denise, I just want to say that I'm pretty sure Contra Costa was one of the early adopters of JI, because they did either health home or whole person care. And so if I remember correctly from talking with Dennis last year, they rolled that out in January. So it's not necessarily a new, in this realm, a new population of focus.
That's a really good point, Amy. Yes, and it might even be interesting too, and maybe Emily, we can jot this down as a something that we can circle back on. You know, for other counties that are just introducing this, there may be some lessons learned that Contra Costa could share with regard to the JI transitions. Thanks, Amy. Leslie, I see your hand is up.
Yeah, thank you. So what exactly might this mean? Because we, even as recently as our last Council on Homelessness meeting, talked about, and we've talked about in the past, how do we get the process going? How do we connect with people while they're still in custody, for lack of a better word, so that because the process takes a long time, so that they don't then exit, and then the only resource they have is to hit the emergency response system. Is there any way that this new population of focus, that work can begin before they're actually out with nowhere to go?
Yeah, I mean, I think that's a great question. To Amy's point, this is something that may be working better in Contra Costa than it is in other regions. So this is something that we should talk about a little bit more. Amy, I see you put a note here in the chat. There is a separate JI initiative, and that is the 90-day pre-release. So what Amy's referring to is the 90-day pre-release, Leslie, which sort of solves a good chunk of that workflow issue that you just described. And that it was initially set to go live in 2024. It's been extended.
So
There's a
Denise, I don't mean to stop you.
no, that's fine.
So the 90-day pre-release to get into Medi-Cal did start last January. There was an all-plan letter starting it, so that did happen. The part that's going to roll out is the justice involved pre-release work. There's two parts to that. One is the Medi-Cal, and the second one is a care manager that does fee-for-service work in the correctional facility to help with the appointments and medications and all the things that people need. And then that person may or may not be their case manager post-release for populations of focus, depending on how each county uses the pre-release services, if they do it in-house versus contracted. But that it talks exactly to what Leslie is talking about. And that was supposed to start April 1 of this year and was pushed back to October. So it's a whole separate, it's not ECM, it's not community supports, it's a whole separate initiative under Justice Involved.
Yeah, and my understanding, Amy, is that timeline is different by each county.
It is, it's a rolling, so it was supposed to start April 1, but the California Department of Corrections and Rehabilitation and the sheriffs, which is usually the ones that have oversight in county jails.
Yeah.
It's like almost like DHCS, like for its complexity. And so they're starting October 1 with a rolling date, and I think they have almost 2 years to actually
do.
start it. So I don't know where Contra Costa is in that pathway, but it is a definite rolling thing that will address exactly what Leslie's talking about.
Yeah, I think that's
That's-
go
That's
ahead.
great that it's at least on the horizon.
Yeah, I think that and that's, I think, what to Amy's point is happening before before release and in conjunction with somebody shepherding that transition, and that's that 90-day window. But other counties and some that have been operationalizing enhanced care management services for JI population are working on workflows even outside of that change that's upcoming. And so we could bring that to this group, or Leslie, we can talk about that offline as well, to prevent the issue that you're describing. So recognizing that there's that transition that happens, and now we have individuals in other regions who have not historically been eligible, but are eligible for enhanced care management. How can we sort of incorporate that warm handoff so that they don't fall through the cracks and either wind up in the emergency room or in other places, because that care transition and handshake isn't as smooth as it could be. So, we can talk more about this as well. Okay, so I'll flag that as it's something to bring up in a future meeting, and then we can pull some best practices too. I'll also flag that we can just make sure that we know what the current state is in Contra Costa. Okay, cool. Let's go ahead to the next slide. Okay, next slide. We started talking about this at the top of the call. The cited capacity and infrastructure transition, expansion, and development. No wonder it has an acronym for cited. Has a round 3. We just saw some information get pushed through today that it is, we have the official paperwork, and there is an upcoming office hour. So we'll share that with you. We also have a Q&A, and applications, just as a reminder, are due 2/15 of 24. And then there's just another quick critical call out. Round 3 applications, and I think this was true for some previous ones as well, but there is content in there around language that your activities or the group or organizations or single organization applying for round 3 need to be able to articulate how they may impact the county's population of focus gaps, any MCP provider network exceptions, or corrective action plans, CAPS. So we have a link for you from DHCS that does outline that by county. However, we are hearing across the state, in particular with managed care plan gaps in network, that JI just in general and contracting with JI providers for enhanced care management services across the state has been limited. The network just overall has been limited. Any questions about cited before we talk about TA Marketplace? Okay. We have some other information on TA Marketplace for those who aren't taking advantage of it. There are services available to you both off the shelf or hands-on. And we have some information on this slide, but there's also an upcoming webinar that talks a little bit more about the TA Marketplace in general. And I think we've given you guys the link for that as well. Any questions on TA, technical assistance? Thanks, Emily. Okay, next couple of slides are just those dates, but again, like I said, we'll share them with you. DHCS cited office hours today, oddly enough, again on the 29th and on the 31st, so Monday and Wednesday of next week. All right, and then for the TA Marketplace, there is an upcoming webinar in February. We'll also do our best to share, as we hear about any news or updates, to share them in Slack, so that in future monthly meetings, we're spending the time doing more activity work and not so much share outs. Okay, so just last one on this, and I'll call out the data exchange framework. So it's not sort of under DHCS or PATH. It is something that's under CHHS. And there is a deadline coming up for required signatories that's less important for the majority of you on the call. But there are some grants available associated with the data exchange framework. And we talked about the data exchange framework in the fall of last year. We can bring it up again in a future webinar. We can share that presentation that we did in the fall if you're not familiar with it. But there are some grants available to help with infrastructure in support of sharing data electronically with other care providers. And so from a very, very high level, that's the intent of the data exchange framework. So it's not a connect specifically to this thing in the state of California. It's really sort of a rules of the road on how data could be shared electronically. There are, in addition to just that high level aspect of the data exchange framework, there is nested under it rules, policies and procedures associated. So if you are an organization who signs that data sharing agreement and says, I'm going to be part of this data exchange framework, I'm going to apply for a grant. In addition to signing that data exchange, there's a whole slew of rules, policies and procedures associated with the data exchange itself. So the actual action of exchanging that data. Okay, so let's go ahead to the next slide, unless there's any questions. Oh, really quick, Ryan, can you talk about PHM updates, population health management?
Yes. So I can give folks a brief, I won't get into all the details, but basically, if you're not familiar, population health management is, it is a component of Medi-Cal transformation, and ECM and community support sort of fall under that. And so the idea is that population health management is that all Medi-Cal members have access to the services and resources that meet their needs, whether they're high or low needs. And so it officially rolled out, I think, last year, but starting in January of this year, there was a couple of changes. And so there is, yep, thanks, Emily, for putting that in the chat, but there's an updated policy guide that just came out, I think, this week. And so specifically in the area of transition care services, which was it was originally designed for folks with higher needs who are transitioning maybe from hospitalization or from acute care into a different type of a setting. But starting this month, they've sort of created a two-tier system, essentially. It's probably not the best word, but they have a track for higher risk members, and then they have another track for everyone else, essentially. And so the higher risk members are going to be those who have long-term support service needs, pregnant individuals who were hospitalized during their pregnancy or within the 12 months post-pregnancy, as well as people who are enrolled in complex care management and ECM. And so while you can't be in CCM and ECM at the same time, you can be in ECM and transition care services at the same time. And so in those types of settings, the ECM, like the lead care manager, would be the care manager responsible for sort of helping that member make that transition. So making sure that they're getting connected to all of the right services. And so as that process goes, once the individual is connected to all of the supports and services they need sort of to maintain that stability post discharge, then they would transition away from the transition care services, and it would really just be more focused on the ECM services. But I mean, there's definitely some overlap when it comes to that. There's a lot of similarities. And then for the lower risk members, which is everyone else, I mean, there's not a specific care manager requirement, but there is a designated, like, so the plans have a designated transition care services line that people can call to ask for guidance and support, and they can connect members accordingly if they need additional support. But the idea is that if they don't need that level of care, then, you know, let's not make them go through it. So those are sort of the big changes that came along with the newest policy guide, but sort of a very quick summary of some of the parts I think that specifically will overlap with a lot of what's going on now with ECM and community support. So certainly if you have questions, you can reach out, but we just wanted to share a little bit of that for now.
Thanks, Ryan. If you want to go ahead, Emily, and advance to the next slide. I think, Ryan, you're still on deck.
Oh, yes. All right. So the survey, you can jump right to the next slide, Emily. There you go. So the survey that we've been talking about over the last couple of months. So sort of a quick recap for those who maybe weren't in those meetings or those discussions sort of the end of last year. We had a couple of design sessions, as we called them. So we brought together housing providers, and that was an in-person session that we had. And we also had MTM providers, which we did virtually. And we were getting feedback and insights from participants around the types of information that they would need or would be helpful to them for making referrals to other programs. So if they can't, you know, if they only offer certain services, how do they know about what other services exist, and how can they make those referrals? So we took that information and all the feedback that we got from those two groups, and we developed a survey that we sent out. And so the survey attempts to collect a lot of that information. So it asks about like basic contact information, point persons for different programs, you know, and then we ask about are you an ECM provider? If you provide community supports, what are those services and how does someone get referred to those? And also we asked about non-CalAIM services. So if there's other things that your organization does, you know, we wanted to know that as well. And so the idea is that we would be able to develop so the longer term strategy is developing more of a geographic map of all of the services in Contra Costa. And so I know there are different tools and things that currently exist now, but based on the feedback that we were getting, there's not all of the information that providers are looking for is not housed in a single resource that's currently available. And so the survey was a way to capture that information. And then the next step is going to be, okay, let's take the information that we've captured, and providers could essentially test it out. So you could take that information, and when you're working with people, and you need to make referrals using that information, so that, and giving us feedback around, is it helpful? Does it work? Is it meeting the needs? What could we do differently? And so that's sort of where the test of change comes in, as we are trying to iterate that process to see how we can best collect that information. And so you'll see on the screen, we've gotten 10 survey responses so far, so that's great. And then what's going to happen is we will take that and put it into a basically a public facing dashboard that we have developed, and it will have all the organizations and the services that they provide, and a few other pieces of information as well. But what we wanted to do today is, if you're not one of these 10 organizations and you haven't completed the survey, Emily put the link in the chat. It takes about 10 minutes, I think, and it's going to depend on how many programs you have. So if you have a lot of programs, it's going to take a little bit longer than if you only have one or two. But we would really appreciate if you could take the time and fill that survey out. And so what we wanted to do was maybe set aside a little bit of time now to where we can do it a couple different ways. So you can do the survey sort of on your own. Right now, taking the next 10 minutes and working on that, or, we're happy, Emily, Denise, or I are happy to walk through that with you, and you can give us the information, we can fill it out for you. Just to try to make it as easy as possible so that we can collect the information and then begin to start testing it out. And so that's where we're really going to understand how helpful this process is. And so, yes, if you have not filled it out, we would ask that we could do that now, and then, we'll give you some time back after that. If you fill it out, then you can certainly drop off and have a little bit more time in your day.
Thanks,
Is
Ryan.
Yep.
Yeah, I think so for anybody that's listed in that thank you, you are free to drop. We just, as Ryan was saying, everybody is sort of show of hands in Contra Costa said, we're doubling down. This is something that's important to us. And so we're gonna get as much information as we can to make sure that we can give that dashboard that Ryan was describing back to you all in a way that we can get to that end result. So if you're one of the folks on that thank you screen, you're free to drop, take the time back in your day. If not, we're gonna use this time to just collect as much data as possible. If you don't have all of the answers to the survey, skip the question. We'll take whatever data you have, recognizing that it's not a complete picture. But we want to make sure, given everybody's voting and doubling down on this activity, that we try and work with you in any way, shape, or form to get it to that finish line. Go ahead, Ryan.
I was just going to say, in the chat, Emily mentioned this, and I totally forgot about it earlier, is we also wanted, so our in-person meetings that we have on the calendar right now are all on Fridays. And it has come to our attention that maybe some people are working remotely on Fridays, and so that may not be a good day. So we have this survey of 2 questions. If you could or a poll, if you could just fill it out real quick, just to let us know, 1, do Fridays work? And if not, what day of the week would be better? So we want to try to make it as accommodating as we can. So if you can take a couple of seconds to do that before you, if you're one of the folks that's going to drop off. And if you're not one of the folks that's going to drop off, if you could still take a couple seconds to do that.
Thanks, Ryan.
Mhm.
We know folks hate surveys. We get it. I hate surveys. Unfortunately, this is the easiest way for us to collect the data from you all. So yeah, thanks, Em. Sorry about survey overload, especially right out of the gate in the new year. We're trying to get what everybody voted on as being the next and most important thing to work on based on those design sessions. We're trying to help that get past the finish line. So if you're still on the line and haven't completed the survey, the link is here. Or like Ryan said, we're available to answer any questions and or dictate and complete the survey for you. So if you want us to complete the survey for you, raise your hand and we can go into, we can kind of go one by one and or in a breakout room. Or we can take the time to fill that survey out, and we're available here to answer any questions you have. I feel like we need background music. No, I don't want background
I can volunteer to sing.
music.
Would not be me though.
Yes, that's a great, yes, Emily, they can absolutely fill that out. So we recognize that not everybody is in the four walls of the county. Care is, and people are served in regions. And so if your site locations are outside of the county borders, we're still asking that you fill it out, given where clients receive services. We're hoping to make this a good and robust thanks, Emily. We're hoping to make this a good and robust directory that is payer agnostic and systems agnostic, so that it has all of the information in the region in a way that you can easily get to what you need. Emily, maybe I saw that you sent me that note. Can you just flag that we should just reach out to her and follow up? As folks are completing the survey, any questions or issues?
Hi.
Hi, Natalie.
Hi, Natalie with J&M Home Care. There's a couple, I'm just starting the survey and I was trying to email some of my team members to confirm something. And I see it doesn't look like I can go forward and come back until each page is complete. And that's correct. You can't save it and go forward and navigate back and forth.
That's a good question. Emily, do you know if that's how it was built? Ryan, you have the Excel spreadsheet, right?
Mm-hmm.
What we can do, Natalie, is just, we can make it a lot easier for you. We can share it in an Excel template.
Perfect.
And that way you can not have to worry about.
Sure. Or at least know what what information to gather in advance, or if I can submit with the Excel on an Excel spreadsheet. I think this is fantastic. So I'm definitely excited to, submit that. But I just want to confirm a couple things.
Yeah.
So that'd be great if we could do the Excel. Thank you.
And I can
do a Word doc right now for you. I'm working
there you
on
go.
that right
Okay.
now.
Thank you,
Great.
Emily. I was going to say the Excel I have, but I would need to do a little playing around so it's not like a ridiculous thing I send you. So, but thank you, Emily.
Thanks, Jacqueline. We're also going to try and push this out to other community members. So if there's folks that should be part of this directory that maybe aren't part of the CPI, this collaborative, we're going to encourage them to fill it out as well. We'll share the link in the Slack, and we can also post it on our website.
And you're
And-
certainly welcome to share that with your networks as well within the county.
And then we have Natalie's email, right? I think. Natalie, if we have your email, you're free to drop, and what we'll do is we'll make sure that we send that to you in template form so that you can complete it. And then, you know, we may bug you a little bit as we work to try and get this as close to done as possible.
Okay, yeah, sure, no problem. Thank you. I mean, you should have it on the registration. Did you want me to put it in the chat, or do you think you have it there?
Emily's confirming we're good to go.
All right, thank you so much. This was my
Thank you
first
so much,
collaborative with
Natalie.
you guys, so thanks.
Oh, wonderful. Well, welcome.
Thanks for
welcome,
joining
and
us. Yeah.
Yeah, I'm excited. We're, you know, we started this CalAIM process a few months back. So, but I'm learning so much, and I'm very grateful for the collaboratives and, you know, just again, thanks so much. You guys have a good day.
Thanks again,
You
Natalie.
too. Thanks.
Okay, bye.
Tara, I absolutely love your glasses.
Thank you. They're Zenny actually. And I have like 8 pairs in different colors, and they were $10 frames.
I
and-
am a huge Zenny fan. Yeah. that and the Warby Parker, although
Yes.
they're definitely not $10, but they're still better than the eye doctor, right?
Yes, absolutely.
Not had good luck with Zenny.
No.
No?
Ever. No, I think it's my PD. I think I don't measure it correctly, and so it's always like kind of off.
Mhm.
That, and I have a very, very strong prescription, so it doesn't always work out the best.
I'm sorry. I'm sorry for you, Emily.
Because I love cute glasses. I love cute glasses, and
Yeah.
especially yours.
Mm,
I would have one for every different day of the year. But I did try Pair Eyewear, where you can like with the toppers and you
With the
can like
thing.
click them on
uh,
and you can accessorize for the holidays.
Remember when they used to have watches and stuff that, like back in the day, and you'd screw off the little face and screw on the new one? That's what
Oh,
those
yeah.
are, and they're so cute.
But anyways, that's my 2 cents to conversation. Not related to past CPI at all. But
Love those. I'm wondering too, Sarah, I know you joined late. At the top of the start of the call, we asked about MCP transitions. I'm just wondering, last I knew you weren't contracted with CCHP. Were you able to move that forward?
Sarah, me?
Yeah.
We're contracted with.
Oh, why did I don't know. It's just my brain. See, then
Alameda is who we're waiting for.
oh, that's what I knew there was a contracting issue, and then there's another care provider that's having a contract issue in the MTM space. So I'll
Oh.
double check.
In Contra Costa.
Yeah.
I
I think
don't
it's
know.
Mom.
Hmm?
Is it Mom's? No, I don't think it's Mom's.
Mom's has been there for a while.
Yeah.
Contra Costa has always had a lot of food providers.
How do you go to that food as medicine work group?
I personally don't, but my team does. Yes, Francesca does. She's not here today, I don't think. But yeah, she went yesterday. She goes every week.
I'd love to hear how that's going. I should circle back with and Emily and I met a few times with the chairs of that work group, and connected them with some folks downstate as well that are trying to do some progressive stuff under that food as medicine umbrella.
Oh, yeah, we'd be happy to talk to folks downstate if they need help.
Yeah.
Who does medicine thing? So Francesca, who usually comes to this meeting, she goes, and then I don't know if you've ever met my colleague Emma. We don't make her come to these. She's busy running the program.
Yeah,
But I could connect you with Emma. Emma Hodson is her name if you want, because she does most of the like real boots on the ground organizing for our food as medicine program.
yeah,
You
that'd
can
be,
reach out to Francesca too.
yeah. Emily, you talked with them, right? Under the Food as Medicine work group. That was a while ago. It would be good for us to reconnect. We also have some other members of our team that are located actually in the Contra Costa region. So I think you've met
Yeah.
right. Lauren has been
Yes.
in the in-persons before, yeah.
Yes. Yeah, Michelle Wong is the doctor who runs the group now. And if you know her, you could talk to her, but yeah, reach out to Francesca if you want to learn more too.
That's great. Thanks for that. I'll also figure out who the MTM provider was that was not able to contract, and we should check in with them for 2024. Thanks for that, Sarah. Thanks,
Uh,
Tara.
Yeah.
How's everything else going, Sarah?
Things are okay. So we launched pediatric obesity in the fall, and that's been going really, really well. And we're supposed to be launching with adult obesity in English and Spanish and with gestational diabetes in English and Spanish in 2024. It keeps getting pushed out a little bit because the model we have with Contra Costa, with the CCRMC,
Yeah,
is that there's a provider who's present in every class. And they've been having trouble identifying a provider for gestational diabetes and adult obesity. And then unfortunately, the PEDS provider is retiring. Dr. Allen, the walking doc. I don't know if you've met Alan, the walking doc.
and it's got to be an MD, is that?
No, especially for gestational diabetes, I think they're looking at a midwife or an NP or an RD.
Okay,
They
that was my
bill it as
question.
a group medical visit
Yep,
on their end. And it just works really well for everybody because they're very engaged and like they're motivated to refer people to the program because they're billing it as a group medical visit. And so it's just like a win-win for everybody, except it seems like the one weakness is they are having a little trouble finding providers who can do it. And so I don't really know what's going on internally with them. And then, yeah, Dr. Allen, who is the big push behind the PEDS program, is retiring. So we are planning to launch adult obesity and gestational diabetes this year, but we thought we would be doing it in the spring, and it looks like it's getting pushed out a little bit. But the original diabetes group is going strong. We've had people recently leaving the program because they've tapped out at a year. So people who've been receiving groceries and coming to class for a year are graduating, which is exciting and sad. Like they should just get groceries forever. But the diabetes program is going really well, and the PEDS program has been going really well, and hopefully we'll be able to just continue seamlessly with a new provider.
that's great. That's great to hear. As you launch, if you want us to make sure that we announce it in a collaborative meeting, so folks know, just let us know.
Yeah. We also we're talking with Lifelong about partnering with them as well. And I'm not in that conversation, but I know Francesca is talking with them. And that would be different than what we're doing with CCRMC. I don't know what level their providers would be engaged in, or if it would be more like a normal CalAIM program where that we're just getting referrals and
Yeah,
we're doing all the communication. So I can keep everyone posted on that too.
that would be great. Thank you so much. Do we have, Sarah, your information for this survey?
18 Reasons was
Yes.
on the thank yous.
Okay,
So
very
I
good.
think
Yes.
I think so.
All right,
I
perfect.
filled it out multiple times. We're in 3 collaboratives. I think I did it 3 times.
I know everybody's asking for this. It's so sad that this has been an issue identified in every single collaborative in every single county, which to me says we need a different solution. But anyway.
I mean, they could just have you do one survey for all counties and have a question for each county.
And then stand up a directory across the state.
I mean, who am I? Who am I?
Too simple. Yeah. It needs to be more complicated than that. Yeah.
Yeah, exactly.
Okay.
Well, we're excited to get this one behind us and to move this into the next phase, to be able to kind of really prototype a visual of what this would look like for the region. So, well, we won't keep you unless you have other stuff that you want to cover. I think it's just the 4 of us right now.
Oh my God. Yeah, I was looking, I was like, I thought there were more people in this meeting. No.
No, we
I'm
cannot
good.
get this survey. We cannot get this directory filled out, and we are determined to make space in these meetings until we get it done.
Listen, honestly, we have the same problem with our evaluations. You cannot get people to do surveys on Zoom.
We can't get, I mean, everybody's survey fatigue. I
Yeah.
mean, it's,
Well, and as soon as we put a survey up, everyone's like, oh, peace.
yep.
So it's been
Well-
very hard. Like in person, we have 100% participation on surveys because they sit there and they do the survey. And on Zoom,
Yeah.
it's like 20%. It's bad.
Yeah, it's really bad. So I'm excited that we'll have more frequent in-persons in Contra Costa. You won't see our face because we're on the East Coast, but you will definitely see Shelby and Lauren. And so I think they'll also be bugging folks in February's meeting who didn't fill out the survey.
Yeah.
To
You
get
won't see my face either because I live in San Francisco. But you'll see someone.
Yeah, that sounds great. All right, well,
maybe they
enjoy the
should
rest
just
of
lock
your
the door.
Friday.
Oh, also my daycare is closed that week.
That's always fun when that happens.
So you'll see me and my 2-year-old on the Zoom option.
Emily had hers call her yesterday and say, we don't have enough staff for your kid's class. So basically, don't send your kid to daycare today.
Oh my God. Okay. So that happened at our daycare, but they were like, we don't have enough staff for the baby class. So all the babies who are 2 are going to go to the big kid class today. I know.
It's nuts. My neighbor has a 2-year-old, and their daycare called them in the last couple of months, like one day, and said, we don't have enough staff for your child to come back. Like, so they basically like kicked them out of daycare permanently. And it's like, how do you do that to somebody?
Childcare is
It's a
in crisis.
big place too.
Oh yeah. 2 weeks before my 2-year-old was supposed to start daycare, like when she was 3 months old, they called me and they're like, we don't have room for her for 3 more months. I was like, I start my job next week. So like, what? Yeah.
I don't get
Crazy out there. Never have kids.
it.
Too late,
Except
but
sometimes they're magical. Sometimes.
They're magical. The systems that are around us are not magical.
Not.
The children are wonderful.
Yeah.
Trying to find someone to watch them is not wonderful.
No, it's not.
Or oh yeah, no, I know those feels. Oh, I'm very lucky. We have in our district a 4-year-old pre-K that is full day.
Same. My kid is there.
Nice.
Thomas Edison Charter. She is there today. Yes. She's eligible by a week for the universal pre-K in San Francisco. She is there.
I should have done research
Nice.
before having kids for like to plan out birthdays.
I know, right? Like,
Be
what's
like,
the
okay,
best time
you
to get the
qualify
most
here.
free childcare?
Well, Sarah, we should connect with you in April. We'll be in San Fran. So Ryan, Emily, and I are going to be making the trek in April. I think it's the last week in April.
Okay.
Yeah.
We gotta,
Let me tell you,
we owe
our
you at
April
least a
calendar.
coffee for all this
we-
craziness.
Yeah, come and hang out. We ticket our public cooking classes about 6 weeks out. So if you want to come and take a class, check our calendar about 6 weeks before you come, and you can come take a class at 18 Reasons.
That
I don't
is
know if you know this about us.
awesome.
We run a cooking school.
That would be
Emily,
fun.
Ryan, let's do that. That would be a great team activity for the rest of the
Yes.
staff. Oh, cool. Well,
Yeah.
thanks for that, Sarah.
Yeah.
No,
come on out.
yeah, I'm
Yeah.
definitely gonna note that down so that we can do that. You might have all of Intrepid Scent coming.
We're a fun
to
group
us.
though, so
Well, if you seriously want to do either a private class for your group, let us know as soon as possible. Let me drop the link. depends on how many people are coming, if you want to like buy a bunch of tickets in a public class, or if you want to do a private class, we do private classes. I'll send you the link for the private events as well, because if you know your dates, we could book a private class for you now.
Very
Thank
cool.
you. Sorry,
That's
my
cool.
dog just ate grape jelly, so we gotta go do something about that.
Never a dull moment.
All right, well,
Cool.
see y'all in April if I don't make it to Contra Costa before then.
That sounds great. Thanks so much,
Yeah.
Sarah.
Thank
Thank
you.
you. Have a good one.
Thanks, you
You
too.
too.
Bye.
Bye.
You can drop if you want.